One of the most common technological treatments used in critical care units is mechanical ventilation. This is defined as the use of a mechanical device to inflate and deflate the lungs in patients whose own breathing abilities are diminished or lost. Even though many patients learn to breathe independently after just a short amount of time, for others it can take longer. Now, normally these patients need to go through a weaning process. This is where a patient gradually increases the amount of time they spend free from the ventilator until it gets to the point where they are able to breathe on their own. In fact, the fact is that the longer that the patient remains dependent on mechanical ventilation, the higher the risk of complications and lengthy hospital stays for that patient. Hence, the desire for efficient weaning is needed. The problem is anxiety and stress play a huge role in preventing patients from achieving precisely this goal. Now, why is that? Well, it would appear that the use of sedation to treat anxiety is problematic, as it causes respiratory depression. And respiratory depression is the very same symptom that causes this weaning process to become prolonged. So, as you can see, there is a huge need for a non-pharmacological method to help these patients. Now, keeping in mind that music therapy has achieved such success in many medical areas, this would be a prime target to see if it could have any positive effect. And just as I say that, a study was done to determine the feasibility of incorporating music therapy into a weaning process while evaluating its efficiency. The patient's level of anxiety, the length of time it took to wean the patient off the ventilator, as well as both patient and nurse satisfaction were valued. These interventions were to be carried out for between 45 to 60 minutes 3 times a week. Now, obviously, the best time to do this was around the time that the patient was most stressed and fearful. And as you can imagine, this was around the time of switching from the ventilator to the tracheostomy collar. Right from the start, the patients having this therapy, their heart and respiratory rates significantly dropped. An important fact that encourages the time a patient can spend off the ventilator and with the final result of becoming fully weaned off it. Another wonderful thing was that despite all the patients being critically ill, they all insisted on participating in the music therapy sessions. In fact, there was a remarkable 84% attendance rate, demonstrating that music therapy can be effectively incorporated into an interdisciplinary team on a pulmonary step-down unit that is dedicated to the care of difficult to wean patients.